Human populations in the shared environment. One source. This chapter from Ecosystem and Public Health examines the intricate relationships between human populations and their shared environment. It traces the historical impacts of human activities, such as urbanization and industrialization, on global ecosystems and, consequently, on human health, highlighting the emergence of new diseases and environmental degradation. The text analyzes contemporary challenges, including globalization, resource consumption, and climate change, and their implications for public health worldwide. Furthermore, it explores the necessity of international cooperation and the roles of various organizations in addressing these interconnected environmental and health crises.
What are indicators to measure relationship between ecosystem and public health? Based on the information in the sources, several indicators can be used to measure the relationship between the ecosystem and public health. These indicators often reflect changes in either the environment or human health that are linked to interactions between the two. Here are some key areas and examples of indicators identified in the text. 1. Disease patterns and environmental change. Incidence and prevalence of infectious diseases. The sources note that changes in the environment, such as increased human population density, agricultural practices, and globalization, can lead to the emergence and spread of infectious diseases. Monitoring the rates of diseases like tuberculosis, diarrheal diseases, malaria, and emerging infections can indicate how environmental changes are impacting public health. For example, the rise of trade in animals can facilitate the spread of viruses. Nutritional deficiencies. Environmental factors like land degradation, water scarcity, and climate change can affect food production and availability, leading to nutritional deficiencies. Tracking rates of undernourishment and related health problems can be an indicator of ecosystem impact on health. Respiratory diseases. Air pollution, often stemming from industrial activity and vehicle emissions, can lead to an increase in respiratory illnesses. Monitoring the prevalence of respiratory infections and other lung diseases can be an indicator of air quality impacts on public health. Waterborne diseases. Lack of access to clean water and sanitation, often linked to environmental degradation and inadequate infrastructure, can result in outbreaks of waterborne diseases like cholera and typhoid. The incidence of these diseases can indicate the state of water resources and sanitation systems, which are part of the ecosystem. 2. Environmental quality and human exposure. Pollution levels. Measuring the levels of pollutants in air, water, and soil can directly indicate environmental degradation that can harm human health. Increased levels of industrial and agricultural pollutants are highlighted in the sources as threats. Deforestation rates. The clearing of forests can lead to increased contact with disease vectors and the emergence of new infectious diseases. Monitoring deforestation rates can be an indicator of potential risks to public health. Land use changes. Conversion of forests to agricultural land or urban areas can affect biodiversity, water cycles, and disease ecology, impacting human health. Tracking land use changes can provide insights into potential health consequences. Exposure to environmental hazards. This could include tracking exposure to pesticides in agricultural areas or exposure to increased ultraviolet radiation due to ozone depletion. Measuring these exposures can help assess the associated health risks. 3. Resource availability and health. Access to clean water and sanitation. As mentioned earlier, this is a crucial environmental determinant of health. Monitoring the proportion of the population with access to these basic resources can indicate the potential for waterborne diseases and other health problems. Food security. The ability of ecosystems to provide sufficient and nutritious food is fundamental to public health. Indicators related to food production, distribution, and access can reflect the health-supporting capacity of the environment. 4. Demographic and social factors with environmental links. Migration patterns. Environmental degradation, resource scarcity, and natural disasters can lead to human migration, which can in turn impact health in both the origin and destination areas. Monitoring environmentally induced migration can highlight ecosystem stressors affecting human populations. Urbanization and living conditions. Rapid and unplanned urbanization can strain infrastructure, leading to poor sanitation, overcrowding, and increased disease transmission. Indicators related to living conditions in urban areas, particularly in less industrialized countries, can reflect the environmental health challenges associated with urbanization. It is important to note that the relationship between ecosystems and public health is complex and influenced by a multitude of interacting factors, including social, economic, and political conditions. Therefore, a comprehensive assessment would likely involve a combination of these and other relevant indicators. Look up the document and find 5 common diseases relating public health and ecosystem change. Based on the information in the sources, here are 5 common diseases that are related to public health and ecosystem change. Infectious diseases in general are frequently mentioned as being linked to environmental changes. Source states that large-scale increases in the size and density of the global human population, changes in human values and behavior, increased economic activity and worldwide industrial growth, and related changes in the natural environment all create new opportunities for pathogenic microorganisms to make inroads into human populations. The text further notes that the emerging of infectious diseases has engaged the public health community. Source also mentions that microorganisms that may emerge in remote geographic locations can spread more rapidly to other areas by virtue of the increased speed and frequency of international travel. Tuberculosis is listed in Table 6.1 as a cause of death, and the text discusses how social and economic changes can influence the prevalence of infectious diseases. While not explicitly linked to a specific ecosystem change in this table, the broader context of environmental and social changes influencing disease patterns suggests a connection. Diarrheal diseases are also listed in Table 6.1 as a significant cause of death, particularly in less industrialized countries. The text implies that factors like inadequate infrastructure and sanitation, often linked to environmental degradation in developing regions, contribute to these diseases. Malaria is another disease listed in Table 6.1 with a notable prevalence in certain regions. Changes in land use, deforestation, and climate patterns can affect the habitats and transmission of malaria vectors like mosquitoes, indicating a link between ecosystem change and this disease. Respiratory diseases are mentioned in the context of air pollution, which is a result of industrial activity and other environmental factors. Table 6.1 shows respiratory infections as a cause of death. Pollution, being a form of environmental degradation, links ecosystem changes to respiratory health issues. Furthermore, the text discusses how nutritional deficiencies can be influenced by environmental factors affecting food production. While not a specific disease name, undernourishment and related conditions are a public health concern linked to the capacity of ecosystems to provide resources. The resurgence of vaccine-preventable diseases like diphtheria in areas with degraded economic and social conditions, potentially linked to environmental factors, is also mentioned. Therefore, based on the sources, infectious diseases, in general, tuberculosis, diarrheal diseases, malaria, and respiratory diseases are 5 common categories of health issues with clear links to environmental and ecosystem changes discussed in the text.
What are the main reasons for ecosystem changes? Based on the sources, several main reasons for ecosystem changes are highlighted. Increases in the size and density of the global human population are identified as a significant factor contributing to changes in the natural environment. Changes in human values and behavior play a role in how humans interact with and impact ecosystems. Increased economic activity and worldwide industrial growth are major drivers of environmental change. The expansion of industrial centers has led to increased pollution of land and water. Industrial activity also necessitates the extraction of larger quantities of renewable and non-renewable resources, leading to environmental degradation. Related changes in the natural environment themselves can further drive ecosystem changes. Agricultural development has substantially altered natural systems and trimmed human populations, playing a significant role in shaping human social evolution. The conversion of forests to agricultural land is specifically mentioned as a significant transformation of the planet's terrestrial surface. Urbanization is another key driver of ecosystem change. The growth of urban populations and their increasing ecological footprint places greater demands on land and natural resources imported from outlying rural areas. In less industrialized countries, rapid rural-to-urban migration exacerbates pressures on infrastructure and resources, often leading to environmental degradation. Deforestation is repeatedly mentioned as a critical ecosystem change with implications for biodiversity and potentially leading to increased contact with disease-causing microorganisms. Land use change beyond just agriculture and urbanization, in general, contributes to altering ecosystems.
The increasing consumption of resources associated with modern lifestyles and economic growth puts a strain on environmental systems. Pollution from industrial activities and other human endeavors significantly impacts air, water, and soil quality, leading to ecosystem degradation. The emissions from automobiles, growing agriculture, and raising cattle contribute to environmental pollution. Global and regional environmental changes pose challenges that often transcend political boundaries. In summary, the sources emphasize that human activities, driven by population growth, economic development, urbanization, and changes in land use and consumption patterns, are the primary forces behind significant ecosystem changes. These activities lead to deforestation, pollution, resource depletion, and other environmental alterations.
Where do ecosystem changes have more impacts on human health in the world?
Based on the information in the sources, less industrialized countries and poorer populations generally experience more significant impacts of ecosystem changes on human health. Several reasons contribute to this disparity. Higher prevalence of infectious and diarrheal diseases. Table 6.1 indicates that diarrheal diseases, nutritional deficiencies, and malaria are significant causes of death as percentages of total deaths in less industrialized regions like sub-Saharan Africa and Asia compared to OECD countries, the more industrialized nations. These diseases are often linked to environmental factors such as lack of clean water and sanitation, food insecurity due to land degradation, and changes in vector habitats. Greater reliance on local resources. Poor populations often directly depend on their immediate environment for resources like fuel, wood, arable land, and clean water. Degradation of these resources directly affects their livelihoods and health. Limited access to infrastructure and services. Megacities in developing countries experience problems with underdevelopment, including higher rates of infectious diseases and higher infant mortality rates. The prevalence of poverty, municipal and industrial wastes, and the inadequacy of infrastructure and services in urban areas of poorer countries contribute to poor health outcomes. Vulnerability to environmental degradation. The sources suggest that poorer populations often bear a disproportionate burden of environmental degradation. They may have fewer resources to adapt to changes like deforestation, water scarcity, and soil erosion, making them more susceptible to negative health consequences. For instance, deforestation can lead to increased contact with disease-carrying organisms. Economic and social conditions. The text mentions that economic and political changes, such as the collapse of the Soviet Union, led to degraded economic and market systems, contributing to declines in public health, including resurgences of vaccine-preventable diseases in affected regions. This suggests that socioeconomic factors, which can be intertwined with environmental conditions, play a crucial role in health outcomes. Food production challenges. In less industrialized countries, food production and health will be significantly influenced by demographic trends and associated increases in the demand for water, food, and other resources. Land use change in these regions, such as the conversion of forests to grazing land and agriculture, can have major health effects. Migration and displacement. Environmental degradation and resource limitations can contribute to migration, which can further strain resources and public health infrastructure in both the origin and destination areas, particularly in less industrialized nations. Refugee populations often live in crowded, unsanitary conditions, increasing the risk of infectious disease outbreaks. In contrast, while industrialized nations also face environmental health challenges like air and water pollution, their more developed infrastructure, access to healthcare, and diversified economies often provide a greater buffer against the direct health impacts of some ecosystem changes. However, the sources also point out that global environmental changes like ozone depletion and climate change pose threats to all regions, though the vulnerability and capacity to adapt may still differ significantly between wealthier and poorer nations.
When did the ecosystem have more negative impacts on human health than standard? It's difficult to pinpoint a precise moment when ecosystem changes definitively had more negative impacts on human health than a previously established standard due to the continuous and evolving relationship between human populations and their environment. However, The sources suggest that the intensification of certain human activities and associated ecosystem changes in more recent history have significantly amplified negative impacts on human health. Here are some key periods and trends highlighted in the sources that indicate a growing negative impact. The period marked by large-scale increases in human population size and density, increased economic activity, and worldwide industrial growth. The sources explicitly state that these factors create new opportunities for pathogenic microorganisms to make inroads into human populations. This suggests that as these trends accelerated, particularly with industrialization, the potential for negative health impacts from environmental changes also grew. The rise of industrial centers led to increased pollution, creating unsanitary conditions and facilitating the spread of infectious diseases. The era of rapid globalization and increased international travel. The sources note that microorganisms that may emerge in remote geographic locations can spread more rapidly to other areas by virtue of the increased speed and frequency of international travel. This acceleration in connectivity means that localized ecosystem disruptions with health consequences can have broader and more rapid impacts on global public health. Periods of significant social and economic disruption. The text mentions the health consequences following the collapse of the Soviet Union, where economic transition led to declines in public health, including resurgences of vaccine-preventable diseases. This example illustrates how significant social and economic changes, which can be linked to environmental pressures or resource management issues, can have direct negative impacts on human health. The ongoing trends of deforestation and land use change. The conversion of forests to agricultural land and other uses is highlighted as a major planetary change. This can lead to increased human contact with disease vectors and emerging infectious diseases. The sources suggest that deforestation has historically brought humans into contact with previously unknown disease-causing microorganisms. The increasing ecological footprint of urban populations. The growth of urban areas, particularly in less industrialized countries, places increasing demands on resources and infrastructure, often leading to environmental degradation and poor health outcomes. The prevalence of poverty, pollution from municipal and industrial wastes, and the inadequacy of infrastructure and services in urban areas of poorer countries contribute to poor health outcomes. In summary, while a precise start date is not provided, the sources indicate that the intensification of industrialization, globalization, and significant land use changes, driven by increasing human population and economic activity, have led to a marked increase in the negative impacts of ecosystem changes on human health. The sources express ongoing concern about these trends and their future implications for public health. What actions does the document suggest for human effort to slow down the negative impacts of ecosystem on public health?
The document suggests several actions that require human effort to slow down the negative impacts of ecosystem changes on public health. International cooperation and agreements. The document emphasizes the necessity of cooperation and coordination among countries to address global environmental health issues. This is crucial for dealing with problems like ozone depletion and climate change, which transcend political boundaries. The success of international agreements like the Vienna Convention and the Montreal Protocol in addressing ozone-depleting substances is presented as an example of effective global action. These agreements involved international negotiations, setting targets, and establishing mechanisms for compliance. The challenges in achieving similar consensus and action on climate change are also noted. Addressing underlying causes of environmental degradation. The document highlights that the increasing size and density of the human population, coupled with increased economic activity and industrial growth, are major drivers of environmental change that negatively impact health. Therefore, efforts to moderate these trends and shift towards more sustainable patterns of consumption and production are implied as necessary actions. The increasing ecological footprint of urban populations is mentioned as a concern, suggesting the need for more sustainable urban development. Considering the vulnerability of poorer populations, the document stresses that poorer populations often bear a disproportionate burden of the negative health consequences of environmental degradation due to their greater reliance on local resources and limited access to infrastructure and services. Actions aimed at improving living standards, providing access to clean water and sanitation, and ensuring food security in these regions would help to reduce their vulnerability to environmentally mediated health risks. Integrating environmental and health concerns in policy, the document suggests that governments and international organizations need to recognize the interconnectedness of environmental and health issues. Policy decisions in areas such as economic development, land use, and resource management should consider their potential impacts on both the environment and public health. The role of international environmental law and institutions in addressing these challenges is also highlighted. The role of non-governmental organizations, NGOs. The document acknowledges the important role that NGOs play in addressing global environmental and health issues. These organizations often work in areas such as biological conservation, climate change mitigation, and promoting public health, sometimes in partnership with national governments and international bodies. In essence, the document advocates for a multilateral, multi-sectoral approach that involves international cooperation, addressing the root causes of environmental degradation, focusing on the needs of vulnerable populations, integrating environmental and health considerations into policy, and leveraging the contributions of various stakeholders, including governments and NGOs, to mitigate the negative impacts of ecosystem changes on public health.
Why public health is interdisciplinary and international matters. Drawing on the information in the sources, public health is inherently interdisciplinary because human health is influenced by a complex web of interacting factors that span various domains. These include biological and sociocultural factors. The many human populations that collectively compose the human race have been constantly evolving biologically and socioculturally within the constraints of changing physical environments. Cultural patterns influence infectious disease throughout human history. Demographic, technological, and economic changes. Long-term changes in human social organization and behavior, alongside broader demographic, technological, and economic shifts, have important implications for human beings and the environment, impacting health. For instance, the growth of industrial centers led to social and technological changes that, while bringing progress, also created polluted and unsanitary conditions, fostering infectious diseases. Increased economic activity and industrial growth create new opportunities for pathogenic microorganisms to affect human populations. Environmental factors. Changes in the natural environment, driven by human activities like urbanization, migration, population growth, and aging, have significant effects on future health and the incidence of disease. The influence of industrial activity on land use, such as the conversion of forests to agricultural land, and the extraction of resources have environmental consequences with potential health detriments. Pollution from industrial and municipal wastes in urban areas of poorer countries significantly affects health outcomes. Political and economic systems. The health consequences following the collapse of the Soviet Union, marked by degraded economic and market systems, illustrate how political and economic changes can lead to declines in public health, including resurgences of vaccine-preventable diseases. Therefore, addressing public health effectively requires drawing on knowledge and expertise from diverse fields such as biology, sociology, economics, environmental science, technology, and political science to understand and tackle the multifaceted determinants of health. Furthermore, public health inherently matters internationally for several critical reasons highlighted in the sources. Global spread of diseases, the accelerating speed and frequency of international travel and transportation, a key aspect of globalization, allow microorganisms that emerge in any geographic location to spread rapidly to other areas. This necessitates international surveillance, cooperation, and coordinated responses to prevent and control infectious disease outbreaks that can quickly become global threats. Transboundary environmental issues. Many environmental problems that impact public health, such as ozone depletion and climate change, are global in nature and do not respect national borders. Addressing these issues effectively requires international cooperation and agreements. The success of the Montreal Protocol in tackling ozone-depleting substances demonstrates the potential of international collaboration to address global environmental health threats. However, the challenges in achieving similar consensus on climate change highlight the complexities of international environmental health governance. Disparities in vulnerability and resources. Less industrialized countries and poorer populations often bear a disproportionate burden of negative health impacts from environmental degradation due to their greater reliance on local resources and limited access to infrastructure and services. International efforts are needed to support these vulnerable populations through aid, knowledge transfer, and collaborative projects to improve their resilience and health outcomes. International norms and sovereignty. Addressing global environmental and health problems often involves navigating complex issues related to national sovereignty and the extent to which international agreements can influence national policies and actions. Recognizing that environmental and health effects can extend beyond national borders is crucial for fostering international collaboration while respecting national independence. Global economy and resource management. The interconnected global economy and the international trade of goods can have implications for both environmental health and food security across nations. International cooperation is needed to promote sustainable resource management and ensure that economic activities do not undermine public health globally. In conclusion, the interdisciplinary nature of public health is essential for understanding the complex interplay of factors affecting health, while its international dimension is critical for addressing health threats and environmental changes that transcend national boundaries and for promoting health equity on a global scale. The sources emphasize that effective public health action in the modern era requires both a broad understanding of diverse influences on health and a commitment to international collaboration.
What are recommended actions, big questions, or projects the document suggested for our further actions and studies on ecosystem and public health? The document explicitly suggests a section titled Suggested Study Projects. These projects are designed to encourage further investigation into the relationship between human activities, the environment, and public health. Here are the detailed projects and their associated tasks recommended in the document. Project 1: Population Growth, Industrialization, and Human Health. Objective: to create a keener awareness and understanding of the global effects of population growth, the ensuing industrialization process in developing countries, and their effects on human health. Task 1: identify 1 to 3 examples from Asia, Africa, or Latin America and describe patterns of population growth, the industrialization process, and their effects on human health. Task 2: develop one of your examples in depth and create a presentation. The document suggests the following formats for the presentation: a written paper, a PowerPoint presentation, lecture, or a visually oriented presentation, creation of charts, statistics, photographs, or video. Project 2: Ecological Consequences of Consumption Patterns. Objective: to deepen understanding of the negative impact of developed countries' consumption and wealthy societies' consumption patterns on the global environment and the health of less wealthy regions. Task 1: study the consumption of energy and water in 3 different wealthy regions. Report your findings supported by statistics. Task 2: pick one wealthy region and study its food consumption in depth. Include transportation and waste of food in your report. Task 3: pick one wealthy region, not necessarily the same as in Task 2, and report on sanitation and waste removal. Task 4: on the basis of the reports from Tasks 1 to 3, write a paper on the ecological consequences of the patterns of consumption by wealthy societies. Project 3: Environmental Treaties. Objective: to create a more detailed knowledge of international efforts to counteract ecological and environmental decline. Task 1: search for environmental treaties, establish criteria for select ING a subset, and present them in an annotated list. Task 2: study the Montreal Protocol and give an in-depth report. Task 3: study the Framework Convention on Climate Change and give an in-depth report. Beyond these specific projects, the document also raises several broad concerns and areas where further understanding and action are needed, which can be considered big questions or implicit recommendations. The document emphasizes the complex interrelationship between long-term changes in human social organization and behavior, changes in the environment, and human health. Understanding these intricate connections and feedback loops is crucial for effective public health strategies. The challenges of achieving international cooperation on global environmental issues like climate change, in contrast to the relative success of the Montreal Protocol on ozone depletion, highlight the need for further study into the factors that facilitate or hinder such cooperation. The document stresses the disproportionate impact of environmental degradation on poorer populations. Further investigation into the specific vulnerabilities of these populations and the development of targeted interventions are essential. The accelerating pace of globalization and technological advancements presents both opportunities and risks for public health. Understanding how these trends influence the spread of diseases and environmental change requires ongoing attention. The document notes the tension between national sovereignty and the need for international action on environmental and health issues. Exploring effective governance mechanisms that balance these concerns is a significant area for future consideration. The long-term consequences of modernization and industrialization on human health, including the potential for new and resurgent infectious diseases, warrant continued monitoring and research. Understanding the implications of demographic changes, such as population aging and urbanization, for environmental health and public health systems is identified as important. In summary, the document explicitly recommends 3 detailed study projects focusing on population growth and industrialization, ecological consequences of consumption patterns, and environmental treaties. Additionally, it implicitly suggests several broader areas of inquiry related to international cooperation, the vulnerability of poorer populations, the impact of globalization, governance challenges, and the long-term health consequences of human activities and environmental change.